Hi, my name is Brandy. I'll be doing my indwelling catheter care video for you guys today. All right, let me get my camera set up. You guys can kind of see what I'm doing. This is so hard. Okay, I think you guys can kind of see. So, I have my Foley kit, my Laridol with my female genitalia, the vagina. And I have that all right there. So first, I'm gonna come in. I'm gonna introduce myself. Hi, my name is Brandy. I am your student nurse today, and I would like to be able to place your indwelling catheter today. Can we first start by identifying who you are and your date of birth? Okay, Mr. Jones. Okay, your birthday. So now I'm gonna just verify your orders. Yep. So we're replacing a Foley catheter today, which is the indwelling catheter. So before I begin, because I use these in our kit, are you allergic to latex, shellfish, iodine, or chlorhexidine? No? Sounds good to me. So I'm gonna provide privacy by pulling back my drape. I'm gonna do some hand hygiene before I begin. And what I'm gonna be doing is I'm gonna be placing a catheter into your bladder, and it's gonna stay there. I have to clean your perineal area, and it's gonna drain the urine for you, so you won't have to get up and go to the restroom to urinate. And the reason for this is because your doctor wants you to be bed bound for at least the next 24 hours, and because of the procedure you had. Do you have any questions for me before I begin? And is it okay for me to go ahead with this procedure? Great, sounds good. So I'm gonna bring your bed up to my hip levels to make sure that I have good body mechanics while I'm doing the procedure. And at this point, I'm gonna look at my patient, and I'm gonna look for bladder distension, any rashes or open sores, redness or breakage of the skin in the perineal area, which I do not see. I'm gonna have my patient will be lying flat in a supine position while I'm doing this. So what I want for you as my patient to do for me is, can you bend your knees up, and I want you to put your ankles together and then spread your legs out for me. Great, that gives me a good view of what I'll be working with today. And okay, so I'm gonna do again, I'm gonna do hand hygiene because I was touching the bed and everything. I want to make sure my hands are clean. First, no, let me go back. I'm gonna let my bed rails down so I have working area, and then I'm gonna do my hand hygiene because I want to have clean hands while I'm starting out this. So I'm gonna come to my kit, and I'm gonna pull my right thing out, and I'm gonna grab my Foley kit out of the bag. And then I'm gonna use this nice little bag to be my trash can. Okay, there we go. So I have my kit here. So first I will open away from me to the side, staying in my 1-inch border, and then down towards me. Staying in my 1-inch border, I'm gonna grab my stirrup kit out, and I'm gonna lay this in between my patient legs. Oh, just caught myself, I broke stirrup, but staying in my 1-inch border, I'm gonna lay this in my patient legs. This here is better for males rather than females, and because I don't want to reach over my stirrup, I'm putting my trash bag over here. So I'm just gonna throw it away. I'm gonna take out my clean stirrup gloves, And I'm going to don sterile gloves. So open to the side, open to the top, and then tuck under the cup. Okay, and I'm going to start with my dominant hand. I'm going to pinch the inside of the cuff. And glove only touching the inside of the cuff. And then tuck under the top of this. Yeah. And I'm only coming up so you guys can see me put my gloves on. Okay. And then once the gloves, I'm able to remove my gloves. So this is going to go into my trash. Okay. So what I'm going to do is I'm going to move my tray where I can work with it. And after I do that, I'm gonna take out what I don't need. So I don't need this cup because we're not getting a specimen today. But had we was, I would have just moved it over to the side. I will take my gauze in my clip. I'm going to put my iodine all over my gauze. That's what I'm going to clean the area with. Oh. And then I'm going to throw that away. And then I'm going to move this over into in between my patient legs. Okay. And for this, I'm going to take my lubricant and I'm going to remove this. And that's trash. And I move it around. I'm not moving over my sterile area, I'm moving around it. And then I'm going to spray my lubricant. And I'm going to have my tip of my catheter laying in the lubricant ready for me to use. That's trash. I'm going to attach my solution to the end of my catheter so that I may inflate my balloon once my catheter is in. So now all my supplies are set up and ready to go. So Miss Jones, what I'm going to do is I'm going to go ahead and I'm going to clean your perineal area, your vagina area, and you will feel me touching you with cotton with the iodine soaked cotton. Is it okay for me to go ahead and begin? Okay. So with my non-dominant hand, which will now become my dirty hand, I'm going to take the patient and spread her labia, and with my clean dominant hand, I'm going to take gauze, just soaked with iodine. And I'm going to go an inner stroke from the clitoris down to the anus. And that becomes trash. I'm going to get a new gauze. My gauze literally unraveled on me. Okay. And then I'm going to do one side of the labia and trash. And then do the other side with a new cotton. And then that's trash. Okay. And I still will keep this open so it doesn't become dirty. And then I'm going to grab with my dominant hand my lubricated catheter tip is what I'm going to grab. Making sure I do not touch anything with the tip. And then I'm going to take my catheter and I'm going to insert the catheter, the lubricated catheter, into the urethra. And I'm just going to advance it And you're gonna feel some pressure. Go ahead and bear down while I'm doing this. And I'm inserting the catheter until I get a flash. Okay, I got a flash. I'm gonna bend just a centimeter or two more, just to make sure that I do not have that bulb that I'm gonna blow up in the urethra. So I'm gonna release the labia, and I'm gonna hold the catheter with my non-dominant hand, and then I'm gonna inflate the balloon. And this is going to keep my catheter in place. And then I'm gonna gently pull, and it's in position. So then I wanna take this, and I'm gonna tape it to the patient's legs, or use one of the little things that the hospital provide. I'm gonna take this Foley bag. At this time, if I wanted a sample, I could get it from this bag. I'm making sure everything is clamped on it before I walk away. It is. I'm gonna hang it to the side of the patient's bed. And okay. And I'm thinking, hold on. Okay. So everything is taped and secured. I'm gonna take off my gloves. I'm gonna provide hand hygiene. Everything is secured to my patient. Just taped to her leg. I do not see any wounds. Everything's clean and dry throughout the area that the iodine has dried off. And at this point, I will leave. You know, I'll chart and leave and everything. So this is me returning because the doctor said you can have this thing out at this point. So the only thing that I will need to do this procedure is, of course, a trash can. I need a syringe big enough to withdraw the 10 milliliter, so empty 10 millimeter syringe, and then a little sterile field to, you know, catch anything that might be coming. So, hi, Miss Jones. I'm coming in and I'm gonna remove your dressing. What's your dressing? I'm sorry, your catheter today. Where's my gloves? So I'm gonna grab some gloves. So I'm gonna provide through hand hygiene. I went over everything in the beginning with the patient, her name, her date of birth, verified orders that the catheter is supposed to be removed, and I brought my bed up to my hip level. I provided privacy. I have consent from the patient to go ahead and remove the catheter, and what I'm going to do is hand hygiene, and I'm going to put on my clean gloves. This is a non-sterile procedure when you're removing a catheter, so just clean regular gloves will work just fine. So I'm going to remove the tape that's holding everything to my patient. I'm going to provide a barrier so it doesn't get wet under my patient. I'm going to take my empty 10 milliliter syringe. I'm connecting it to my balloon port, and I'm going to withdraw the saline from the balloon. Okay, I'm no longer pulling solution, so I'm going to take that loose. I'm going to throw that away, and I'm gonna let my patient know this is the time now that I'll be pulling it out. If you want to take some exhales while I'm pulling this out, it might be a little uncomfortable, but it shouldn't hurt. If it does, let me know and I will stop. So I'm gonna start pulling while wrapping it in my hand so there's no splashing. And I'm gonna coil everything, grab everything. This is gonna go into the appropriate receptacle. I'm gonna get my stuff from her. I'm gonna cover her back up. I'm gonna take off my gloves. I'm gonna do some hand hygiene. And then I'm put lip gloves on. I'll make sure everything is okay. Any pain and discomfort, Miss Jones? No? Everything sounds good to me. Everything went fine. So I'm gonna put my your bed rails up. And then I'm gonna lower her bed, lock it into position, give her her call light. If you need anything, you let me know. I'm doing hand hygiene at this point. And then just let me know if you need anything, Miss Jones. Give me a call. And thank you, and I appreciate you letting me remove your catheter today. And I will get all my trash and I'll throw it away, and I will be out the room.